Today we are talking about prostate cancer. Prostate cancer is cancer of the prostate, layman's language, and it affects men. Prostate cancer affects 1 in every 4 men in their lifetime for the blacks, and it also affects 1 in every 8 men in the whites. So you can see it's a very big public health concern for the community. Prostate cancer is the most common diagnosed cancer in men and is the second most cause of death in men. So that makes it a very important issue to discuss. So we are here for awareness. So prostate cancer, as I've said, it usually develops when the number of cells in the prostate produced exceed the number of cells that are dying. And in this, like any other cancer, that's how the cells are accumulating more than the necessary are going to result into a cancer. So here we're talking about how do we get prostate cancer. To be sincere, we do not know the specific cause of the prostate cancer. Usually we have the risk factors, one of which include age. As we grow old, we get high chances of getting prostate cancer. Here, as I will talk about it later about the screening, usually in Africa, 45 years and above, you are at risk of getting the prostate cancer. So we start screening specifically at 40 to 45 years and above. Secondly, family history. Here I'm saying first degree family. As I have said, it's a cancer for the men. So if you have a father or a brother who has diagnosed with prostate cancer, you are at high risk of getting the prostate. We'd actually encourage you to do the screening as early as 40 years of age. Another risk for getting the prostate cancer. Others, we have the recurrent infection of the prostate, prostatitis, and this usually can result in long-term, can result into the prostate. So as I have said, some of these are things that we cannot modify. Age, we have to always grow old. Second, the family history, you have nothing to do with your family. Then thirdly, the color, I'm black, I cannot change that. I would say other modifiable risk factors include the diet, where the processed foods that we usually eat, they are carcinogenic and they have the components of inducing cancer within our bodies. Then you also have smoking and alcohol drinking. So these are the things that we can modify, as well as doing exercise to reduce the risk of getting obesity, and this will be important also in preventing the prostate cancer. One of the challenges that we have here in Africa is late diagnosis of the prostate cancer, whereby we have over 87.5% of here in Africa, they have late diagnosis of the prostate cancer, where we diagnose it in late stages that we cannot treat. But I want to tell you and give you good news that once prostate cancer is diagnosed early enough, it can be treated. Encourage everyone to always come for the screening of the prostate cancer. We have different types of screening of the prostate cancer, one of which is we have what we call the PSA. This is the protein specific antigen. PSA is a prostate specific antigen, is a protein produced by the prostate. So usually it ranges, the normal range I can say is between 0 to 4. So according to what we have found out on the screening test, so we can be advised on what to do next. But usually when it goes above the 4, the upper normal range, so we get concerned and we do other tests. The other test is what we call digital rectal examination. This one shows how we examine the prostate through that examination, and then we see the nature and then the structure of the prostate, how it is. Of course, after examining, us as doctors, we always know what to do next in terms of the findings that we have found in examination. Like I've told you, the good news is once the prostate is diagnosed early enough, it can be treated. There are very many different ways of managing the prostate cancer. But one I'm sure of, once it's early, it is detected early, can always be treated. Here I'm going to encourage everyone listening and watching us that you can always come for prostate cancer screening here at Henrob Hospital, Uganda. The screening is done daily from Monday to Sunday, so you can always come at any time for the screening. However, we always have the urology clinic that runs on Wednesday from 4 to 6 p.m. For those who have their concerns or would like to see a specialist as far as prostate cancer is concerned and other urology cases, allow me give you the symptoms of the prostate cancer. It will be a disservice if I don't mention about the symptoms that are usually going to come up when someone has a prostate cancer. These include frequent urination, most especially in the night. Then you have a stream. All men will know what a stream is. So usually it is weak. You have to force yourself to push the urine out. You also can get urine. You can get blood in urine. And most of these things are going to come up when we are in the late stages of the prostate cancer. You can get pain in the pelvis. You can also get complete blockage of urine, like you do not have urine completely. You can't pass urine completely because the urethra is blocked by the enlarged or the infected prostate.